Thalassemia is a group of inherited blood disorders characterized by abnormal hemoglobin production. Hemoglobin is the protein in red blood cells responsible for carrying oxygen throughout the body. In people with thalassemia, the body produces fewer healthy red blood cells and less functional hemoglobin, leading to anemia, a condition where the blood has a lower capacity to carry oxygen. This disease primarily affects individuals of Mediterranean, Middle Eastern, South Asian, and African descent, although it can occur in any population due to genetic inheritance. Types of thalassemia. There are two main types of thalassemia, classified based on the affected hemoglobin chain. Alpha thalassemia, this type occurs when one or more of the four alpha-globin genes are missing or mutated. Its severity depends on how many genes are affected. Silent carrier, one gene affected, usually no symptoms. Alpha thalassemia trait, two genes affected, mild anemia may occur. Hemoglobin H disease, three genes affected, moderate to severe anemia. Hydrops fetalis, all four genes affected, often fatal before or shortly after birth. Beta thalassemia, this type results from mutations in the beta-globin gene. The severity also varies. Beta thalassemia minor, trait 1 gene affected, usually mild or no symptoms. Beta thalassemia intermedia, both genes affected, moderate anemia, may require occasional transfusions. Beta thalassemia major, Cooley's anemia, severe anemia, usually apparent in early childhood, requires regular blood transfusions for survival. Causes and genetics. Thalassemia is an autosomal recessive genetic disorder, meaning a person must inherit defective genes from both parents to develop the severe form of the disease. If only one parent passes the defective gene, the child may be a carrier, thalassemia trait, without major symptoms. The disease occurs due to mutations in the genes responsible for producing alpha or beta globin chains, disrupting hemoglobin synthesis. Environmental factors do not cause thalassemia, but carriers are often identified through family history and genetic testing. Symptoms. Symptoms of thalassemia depend on the type and severity. Mild forms, trait fatigue, pale skin, slight anemia. Moderate forms, weakness, shortness of breath, delayed growth, and bone deformities. Severe forms, major severe anemia, jaundice, yellowing of skin and eyes, enlarged spleen and liver, bone thinning and deformities in the face and skull, frequent infections, and delayed puberty. Complications. Without proper treatment, thalassemia can lead to serious complications. Iron overload, frequent blood transfusions can cause excess iron buildup in the heart, liver, and endocrine glands, potentially leading to heart disease, liver cirrhosis, and diabetes. Bone deformities, bone marrow expansion to compensate for low red blood cells can weaken bones and alter facial structure. Growth delays, children may experience delayed growth and puberty. Infections, splenectomy or compromised immune function increases susceptibility to infections. Diagnosis. Thalassemia is diagnosed through a combination of blood tests and genetic analysis. Complete blood count, CBC, detects low hemoglobin and small red blood cells. Hemoglobin electrophoresis, identifies abnormal types of hemoglobin. Genetic testing, confirms mutations in alpha or beta globin genes. Prenatal testing, chorionic villus sampling or amniocentesis can detect the disorder in a fetus if both parents are carriers. Treatment. Treatment strategies depend on the type and severity. Mild thalassemia often requires no treatment, only monitoring and managing symptoms. Severe thalassemia. Regular blood transfusions to maintain hemoglobin levels. Iron chelation therapy to remove excess iron from the body. Folic acid supplementation to support red blood cell production. Bone marrow or stem cell transplant, the only potential cure, usually recommended in children with severe beta thalassemia major. Prevention and genetic counseling. Since thalassemia is inherited, prevention focuses on genetic counseling. Carrier screening for couples with family history or high-risk ethnic backgrounds. Prenatal testing to inform parents about the risk of severe thalassemia in offspring. Education about family planning to reduce the likelihood of children inheriting severe forms. Conclusion. Thalassemia is a lifelong genetic disorder that can range from asymptomatic carriers to severe, life-threatening anemia. Advances in diagnosis, blood transfusions, iron chelation therapy, and bone marrow transplantation have significantly improved life expectancy and quality of life for affected individuals. Awareness, early detection, and consistent medical care remain critical to managing this disease effectively.